core muscles. We talk about it all the time in the health, the fitness, and the rehab industries. But how many really know how to assess it, how to fix the core muscles so they do the right thing in a simple and safe way? Stay tuned. So before I head on my back and you barely can hear me clearly, I want to talk about what the right form is. A lot of times the form has to, basically you want to be in the same plane. So if I'm lying down, my feet are facing towards you and my spine is also like a tube running through you. What happens is in an unstable case, there's a lot of shifting and rotating. So the pelvis will do this, it'll teeter this way if my pelvis and legs are facing you. Or it'll do this a lot, so there'll be a lot of extra motion. In a perfect world, it's like a skewer running through your hip joint, and then it just spins in a pure axis. So in a pure axis world, your pelvis just rotates like that, and there's no accessory motions, or it doesn't teeter totter. So what we want is, that's basically what happens when you have the stiff back and all that. There's too much rotation, it breaks down, and you're using other muscles to really try to stabilize that hip and pelvis. So that's the goal for this exercise. All right, so we'll set ourselves up back flat, and you just want to make sure you have a couple things in mind. That your pelvis doesn't move a whole lot going this way, and that the pelvis doesn't move this way. So this plane and this plane. So what you want to do is you want to make sure you assess. And a lot of people with weak cores or back pain, what they'll do is as they lift this leg, they'll drop towards that side. So as they lift, they'll drop towards that side. So that's your assessment. If it happens, you're unstable. Now, what you want is that it spins around a pure axis like this. Like I just took a screwdriver and I'm rotating it, and this all stays stable. I like my hands right here, and you can notice, but the moment that it dips down, that becomes your exercise. You just keep going into that and out of it, and you just keep focusing on this leg coming up. You're not using a whole lot of this other leg, and then once you can get up to about 90 degrees, that's your exercise. And so same thing on this end. You want to see that this stays stable. Now this is a great exercise for those with popping hips. They always tell me they're popping their hips. So this is how it'll pop when it's unstable. So you can go here and it pops. But this is how you work it out, is that you slowly have to stabilize that abdominal corset. So as you get better, you can alternate. And once again, you keep this stable and it doesn't move. Isn't it nice we can do an exercise that you both can do at home, address it with a good assessment and know that you're doing it right? I think sometimes when you don't have any tools or a personal trainer pointing out these core things, that this is something that you can assess and then treat it out by just doing it patiently. Make sure this is a safe exercise for you. Make sure you check with your healthcare professionals. If you like what we're doing, we've got more stuff coming at you. We're really excited to have our awesome videographer Griffin behind the camera, and we're just gonna keep pumping out new stuff for you. So if you like what we're doing, subscribe below, leave a thumbs up, one of these, and any comments, or you can email us privately at rehabandrevivemedia@gmail.com. I'm Dr. Lin. Remember, we heal smarter, not harder.